breast cancer impacts all of us, whether you have a close family member, whether you're a survivor. All of us know someone. It'll be 5 years this spring since my mom passed. And there's not a day, oh, I knew I wasn't going to get through this, that I don't think about her. And I think of all the other moms, grandmas, aunts, and other people who are not with us because of breast cancer. And today, I also think about the work of all of these amazing people who are here in our community. Because I also think today and this month about my sister, who's a survivor, about my best friend, who's a survivor. And it's because of the education, the outreach, and the support that we do have survivors in our community. And that's what we need to uplift this month. That's what we need to continue working on, and making sure that we are there as a community for those experiencing breast cancer and their families. And so we have a lot of wonderful people today. And before I ask my colleague, Councilmember Balcom, to come up, I'm gonna take a page from Councilmember Katz's book and just ask people to kind of go around the room and introduce themselves quickly.
Jody Finkelstein, Montgomery County Commission for Women.
Tondaleo Royster, Commission for Women.
Ingrid Lizama, Latino Health Initiative, part of the Department of Health and Human Services.
Mariana Serrani with the Latino Health Initiative.
Veronica Vela with the Primary Care Collaborative.
Mary McCusker, Hope Connections for Cancer Support.
Oge Okeke with the Primary Care Coalition.
Julia Kepnes with the Brem Foundation to Defeat Breast Cancer.
George McFarland, African American Health Program.
Dr. Keisha Davis, County Health Officer.
Takia Pearson, Montgomery County Cancer and Tobacco Program.
And Christopher Rogers, Acting Chief Public Health Services, Montgomery County DHHS.
Thank you. And now I'll turn it over to my colleague, Councilmember Balcom.
Thank you. Marilyn Balcom. I'm a breast cancer survivor. There are millions of stories about breast cancer, and this one is mine. About 14 years ago, I went to get my mammogram, routine annual mammogram. It was just an errand that I had to run on my way to work. And the results were nothing but normal. The radiologist found a lump in my right breast, and that started a very long, arduous journey, both a physical journey and a mental journey. And every step along the way had its challenges. Probably, of course, the first reaction is shock and disbelief, but then it was fear and sadness. And as a mom, the most difficult moment was to share the news with my daughter, my teenage daughter, and not only the cancer, but the fact that I could not predict the outcome. So we started with, of course, the biopsy, surgery, 5 months of chemo, daily radiation for a month, and then 5 years of hormone therapy. I'm happy to say that it's been 13 very lucky years that I've been cancer-free. Everybody knock on wood back there, okay? So cancer treatment takes its toll. It takes its toll on everyone. I am some the worse for wear. Of course, my hair just never quite made it back. And I'm forever changed. But I'm here. I'm here today because of early detection. I'm here today because I had really great health insurance. I'm here today because I had access to high quality health care. Early detection saved my life. But we know that so many people don't have the same access to the same health care. They don't have access to annual screenings. They don't have access to treatment. They don't have the opportunity and the flexibility for this very long, arduous journey. It is incumbent on all of us here today, all of the people behind me who work every day on this terrible, terrible disease. And when 1 in 8 women experience breast cancer in their lifetime, we all need to do our share. So please, 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 for the women out there, please schedule your mammogram. For the men out there, please make sure that your wives, your daughters, your grandmas, your moms, everyone in your life schedules their mammogram. So thank you all.
Thank you, Councilmember Balcom, for sharing your journey. We appreciate that. Now I'd like to welcome up Julia Kepnes from the Brem Foundation to tell us about the work that they're doing in our community.
Good morning, everyone. My name is Julia Kepnes, and I direct programs at the Brem Foundation to defeat breast cancer. I want to give a big thank you to the County Council, and in particular to Councilmember Kate Stewart, for including us in this important program. The Brem Foundation is an organization that's exclusively dedicated to early detection of breast cancer, and we just heard a little bit about why that is so important. Why do we care about breast cancer? Because it's prevalent, and we just heard that 1 in 8 women will develop breast cancer, and men get breast cancer too. About 1% of breast cancer cases occur in men. And the reason why the Brem Foundation is focused on early detection, laser focused on early detection, is because we see study after study that outcomes are best and treatment is lessened when we catch cancer early, and that's less so when cancer is caught at later stages. Our organization does our early detection work through 3 core pillars. We run education programs, both in person and digital, and we're about to launch this month, for Breast Cancer Awareness Month, a online, very patient-friendly tool all about breast cancer risk, which will help educate patients about personalized risk for breast cancer and give them questions and talking points related to their personal risk to go to the doctors and be able to self-advocate for good care. We run access programs, so we just heard that all of the education in the world does you no good if you cannot access quality breast care. And the Brem Foundation has a transportation partnership with Lyft, where we operate about 14 medical provider partners throughout the DMV and a couple in Baltimore to provide free rides to screening and diagnostics for people that can't afford them, in addition to a grant program that covers the exams themselves for screenings and diagnostics for people who are particularly medically underserved, and an advocacy program that works on a systemic level, both on the state level and federally, to try and level the playing field in breast cancer and make quality breast care accessible to all, regardless of an ability to pay. We have deep roots in Montgomery County. Our offices are in downtown Silver Spring. I myself am a Montgomery County resident, and last year alone we provided hundreds of county residents with breast health education, but importantly, transportation to their appointments and coverage of essential tests. We are so thrilled to be here and thankful to be part of this incredible group, and excited to kick off Breast Cancer Awareness Month together. Thank you.
Thank you, Julia. And now we'll hear from Dr. Keisha Davis. We are so lucky in Montgomery County to have an amazing health officer, to have an amazing Department of Health and Human Services that really supports our community. And so it's my privilege to have Dr. Davis with us today.
Thank you, Councilmember Stewart, for bringing awareness to this important issue. October marks Breast Cancer Awareness Month, a time when we come together to raise awareness about this devastating disease that affects millions of lives. Breast cancer has no boundaries, impacting individuals and families in every community, even right here on our council. And as your county health officer, I stand before you today to proclaim our unwavering commitment to the fight against breast cancer. Breast cancer is the most common cancer among women worldwide, and early detection is crucial for successful treatment. And we know when we look at health disparities that we see worse outcomes in our Black and brown communities where breast cancer is diagnosed later and more severe. The stories remind us that with early detection, advancements in treatment, and a united front, we can stride in reducing the impact of this disease on our community. Throughout October, let's educate, advocate, and support initiatives that promote breast health and awareness. By working together, we can ensure that breast cancer becomes a thing of the past and all individuals can live healthier lives. Together, we can make a difference. Thank you.
Thank you. And now we'll read the proclamation. I'll ask for my colleagues to come up. I think we can just pass it back. Okay. And I think Councilmember Katz is going to join us as well. God, this is really tiny. I'll kick us off. Whereas October is National Breast Cancer Awareness Month, and since the campaign began in 1985, there has been a gradual reduction in female breast cancer in women ages 50 and older. Death rates have declined since 1990 due to better screening, early detection, increased awareness, and continually improving treatment options. And whereas
in the United States in 2023, an estimated more than 297,790 women and approximately 2,800 men will be diagnosed with breast cancer. 1 in 8, or 13% of women, will develop breast cancer at some point in their lifetime, making breast cancer the most common cancer among women except for skin cancer. And
whereas numerous organizations in Montgomery County have dedicated themselves to maximizing every woman's chance of detecting breast cancer early, regardless of her ability to pay, through education, access, and advocacy. And
whereas the COVID-19 pandemic highlighted the disparities in access to needed medical treatment faced by communities of color nationwide, as well as risks that occur. And
whereas we recognize the disproportionate impact breast cancer has on communities of color, especially Black women, whose mortality rate, according to the National Institutes of Health, is 40% higher than average due to factors such as socioeconomic status and access to health care. And whereas
while death rates caused by breast cancer are steadily falling, it remains the leading cause of cancer death for Black women. Reasons for continuing disparities are complex, but are rooted in structural racism, which contributes to inequalities in the social determinants of health, including access to care, according to the American Cancer Society. And
whereas the University of Michigan Health Rogel Cancer Center notes that breast cancer rates increase almost six-fold for Asian American women after immigrating to the U.S. In addition, first-generation Asian women who have lived in the U.S. for at least 50% of their lives are 3 times as likely to be diagnosed with breast cancer compared to U.S.-born Asian women. And
whereas Native American women have a 7% higher cancer rate and have a 10% higher death rate compared to non-Hispanic women, white women, as noted by the American Indian Cancer Center. And
whereas this month we stand with mothers, daughters, sisters, aunts, and friends who have been affected by breast cancer. We recognize the ongoing efforts of dedicated advocates, researchers, healthcare providers, and organizations helping to prevent, detect, and treat cancer, and working towards a future free from cancer in all forms. And whereas
we reaffirm our commitment to fighting breast cancer, especially in our communities of color and immigrant communities, through education, increased access for all women to receive preventative health care, including genetic testing and screening, with culturally competent resources and outreach to all communities. We also reaffirm our commitment to further invest in clinical services for uninsured and underinsured women, while increasing the use of the existing safety net of services to fight breast cancer.
That's what you get when you get a lot of women on the council. Now, therefore, be it resolved that the County Council, Montgomery County, Maryland, hereby recognizes October 2023 as Breast Cancer Awareness Month, presented on this day, the 3rd of October in the year 2023 by the County Council. Thank you, everyone, and thank you to all our guests today.